all, it's Dr. Ruth Doughton here. I'm a board-certified adult psychiatrist, and today I want to talk about a question that I get from my patients all the time, which is, do I have to stay on this psychiatric medication forever? And it's a really good question and something that is going to come down to the risks versus benefits for that individual. Now, nothing is risk-free. That's what's important to keep in mind in this conversation. Your mental illness is not risk-free, taking medication is not risk-free, going off medication is not risk-free, and all of these risks have to be weighed against the benefits of each of the potential options you're considering. So let's look at two individuals, for example. You have one person who is going through a difficult life transition. Maybe they got divorced or they're starting school and they're starting to experience depressive symptoms for the first time in their life. No history of suicidal thoughts or any safety issues. Second person is someone who's had serious recurrent depressive episodes with suicidal ideation. They've had multiple psychiatric hospitalizations. These are two very different situations. For that first individual, well, the risks of taking medication may be low if they're well tolerated, but if they're having lots of side effects, like maybe they have suicidal thoughts for the first time, or they're having sexual side effects, or they're gaining a lot of weight, then that's a significant risk from the medication we have to consider against the potential benefits. Of course, we'd have to look at their response and how they're feeling with the medication and how difficult to manage would their symptoms be without the medication. Then let's look at the second individual. Well, that person has a much higher risk if they're not taking medication. When we look at those potential safety risks of not taking medication versus maybe some side effects of medication, that balance of the risks versus benefits really changes, especially if the medication is really helpful in treating their depression or anxiety symptoms. But again, this is really an individualized conversation that you have to have with your doctor. Wishing you all good mental health today, and I'll see you in the next one.